Top White House health experts issue dire warnings to lawmakers over the nation's spike in COVID-19 cases. Plus, Joe Biden provides more details on his plans to address the pandemic. Skyler Henry is in Washington with the latest.
We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day.
The nation's top infectious disease expert expressed concern over the latest spike in COVID-19 cases, as he and members of the White House Coronavirus Task Force testified before a Senate panel.
Clearly, we are not in total control right now.
Health officials said they are ramping up testing and working to deliver new treatments and a vaccine in the coming months. But Dr. Anthony Fauci also warned that at least 70% of Americans must be vaccinated in order to establish herd immunity. And even then, there's no guarantee.
How long this immunity lasts? Is it a year, 2, 3, 4, or is it even less? Is it months? We don't know.
The witnesses and committee members on both sides of the aisle all seem to be unified on their calls for all Americans to wear face masks to stop the spread of the coronavirus. The committee's top Republican says he's taken that message directly to President Trump.
The president has plenty of admirers. They would follow his lead.
Mr. President, this is not about you. It's about the health and well-being of the American public.
In a sometimes scathing speech, the president's Democratic challenger, Joe Biden, bashed the Trump administration's response to the crisis, while calling on the White House to ramp up testing and the production of N95 masks, as well as treatments and vaccines. Skyler Henry, CBS News, Capitol Hill.
Dr. Bob Lahita joins me now. He is a professor of medicine at New York Medical College and chairman of medicine at St. Joseph Healthcare System. Dr. Lahita, thanks for joining us. What are your big takeaways from today's hearing?
Well, I think, Elaine, that this was predicted, that Dr. Fauci would be disappointed, as are all of us, seeing the spike in cases in places where we did not see social distancing, and we did not, particularly over the holiday, the last holiday, see people wearing masks. In fact, I was shocked by the crowds in bars and other areas such as beaches and swimming pools where we saw people who were unprotected. And we predicted that there would be a surge in cases. And of course, the large number of cases are people below the age of 35, which is exactly what we predicted. So when Dr. Fauci says there's going to be greater than 100,000 cases, it would not be surprising to any of us if that occurred.
Well, we also mentioned that several states have paused their reopening plans as cases spike in parts of the country. What did the doctors say was behind that increase?
The increase is more than likely to be the relaxation of mitigation procedures, and that means wearing face coverings and keeping a social distance of at least 6 feet. The peculiar thing is how we handle this in the Northeast. We had, as you remember, as all of your viewers remember, tremendous numbers of patients, lots and lots of people dying in the hospital, total chaos. We're now seeing that chaos transplanted to the southern states because of the lack of mitigation and the lack of distancing and the lack of adhering to what we know works from the Northeast.
Right, a lot of lessons that were learned here in the Northeast. Well, the director of the CDC, Dr. Robert Redfield, said his agency never recommended closing schools when the pandemic began, and that it, quote, just happened. What steps did the witnesses say they want to see in place in order to safely reopen schools?
Well, I read the pediatric report. The American Academy of Pediatrics really has been the director of the way schools should open. I am hearing personally from teachers who are concerned about getting the virus from students. Now, we all know that young children and adolescents tend to be infected, but basically do not show the disease, nor do they succumb to the disease like adults do. So what is being suggested is that Of course, for pre-K children, they're not going to wear masks. We're all realistic about that. We can suspect or hope that the teacher wears a mask and keeps safe distancing from the children. We also have heard that the schedules of classes could be such that they could be scattered to allow for smaller class size, which would have students at least 6 feet apart from each other and wearing face coverings. And that would go for elementary school and high school students. And so we're hoping, and we know, this is very rare to have a child affected by something called the multi-system inflammatory syndrome. Thank goodness for that. Most children are going to be fine. They may get the infection, they can carry the virus, they will rarely get sick, and that goes for even adolescents. So the big concern here we have now is the teachers. What do the teachers do? They keep their distance, they wear their mask because they can succumb to the virus, and depending on their age, suffer some significant morbidity or illness as a result of being infected by the students.
Yeah, and the fall is really just around the corner here. So Dr. Anthony Fauci did encourage people to wear masks at all times, and the chairman of that Senate committee, Senator Lamar Alexander, had this to say. Let's listen to that.
People wear masks because CDC has said, quote, simple cloth coverings slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. Unfortunately, this simple life-saving practice has become part of the political debate that says this: if you're for Trump, you don't wear a mask, and if you're against Trump, you do. That's why I've suggested that the president occasionally wear a mask, even though in most cases it's not necessary for him to do so. The president has plenty of admirers. They would follow his lead. It would help end this political debate.
So, Dr. Lahita, our recent polling found partisan splits on the topic of wearing masks. What steps can elected leaders take to promote this?
I think every leader should wear a mask, and that includes President Trump. I have seen Vice President Pence wearing a mask, but I cannot believe that the simple decision to wear a mask is being politicized. That's really a little bit loony as far as I'm concerned as a doctor. I advise all my patients to wear masks. I wear a mask at all times during the day in the hospital, except where I am in my office. By myself, I do not wear a mask, but at all times I wear a mask, except outside. Now, you can be outside safely distanced from another individual, and that may be a time that you wouldn't have to wear a mask. For example, President Trump in the Rose Garden giving a speech. I wouldn't expect that he would have to wear a mask while he's speaking to reporters who are distanced significantly and all wearing masks. But when he's in the White House in a closed space with others, he should be wearing a mask. And everybody in other areas, such as the Senate and the Congress, should be safely spaced and all wearing face coverings.
Right, because the science on this is crystal clear. In the absence of a vaccine, we know this is what works, wearing a mask. Dr. Bob Lahita, thanks as always for sharing your insight with us. Really appreciate it.
Thanks, Elaine. It's a great pleasure. Thank you.